He takes his tea in minimal sips, in the smallest of cups. It is what the disease has reduced him to. 45-year-old Ernest Mugisha has been living on a strict diet since December 2013, when he was diagnosed with a diseased kidney. The worst part, however, has been the money spent each week on dialysis.
I parade, you buy, there's a drug for blood, there is for hypertension, and then paying for the dialysis session, which is 60,000. So adding it all, it becomes 300,000
each week. Ernest does dialysis once a week, out of the recommended 3 times, because it's what he can afford. Otherwise, he would be spending close to 1 million shillings, about $400 each week. It is risky for his well-being.
You cannot do dialysis once, even twice. You do it with a lot of restriction of what you eat, so that you actually don't over-accumulate the toxins and the waste product, and water, of course.
Even then, dialysis comes with disadvantages.
See, if somebody is on a dialysis, there's a lot of wear and tear. His health keeps deteriorating despite giving the best dialysis 3 sessions every week.
Dr. Kiran Sashi, a senior nephrologist from Yashoda Hospital in India, says a transplant is recommended.
The cost of keeping somebody on dialysis, say for 5 years, when you compare with the cost of keeping somebody with a transplant for 5 years, the transplant works out much cheaper.
For this, however, Ernest now desperately needs 80 million shillings, a little over $30,000 to go to India.
Currently, we have over 65 patients who are undergoing dialysis, and naturally these would have to transit. We need actually to transit to kidney transplant.
Ernest is one of them and is one of the lucky Ugandans, according to the revelations by the ED at the Mulago Referral Hospital. In collaboration with the Yashoda Hospital in India, a center specializing in kidney and other organ transplants, many Ugandans who suffer kidney disease will be a happier lot.
In October 2014, we hope a specialist team will start carrying out kidney transplant here at the Mulago Hospital.
It will be cheaper as well.
There are people who will be helped completely at 0, okay? 0, you know 0? It will range from 0 to the contribution of about to 6 million.
Now, with the signing of the memorandum between Mulago Hospital and Yashoda to seal the partnership that will see to the transplant unit open, Ernest can hardly wait for October 2014 to get here. You can pay is 0 shillings to 6 million shillings.
Wow, that's a miracle. That's a relief. It's amazing.
Amazing indeed for the nearly 1,000 patients who flock Mulago with kidney disease, with a greater percentage living because of the cost. Plans are already underway with the Yashoda team training health officials in Mulago about kidney transplants. Oblivious of this partnership, Ernest has been the first patient to get worked on by the Indian specialists.
Actually, we have been doing dialysis here. We are going to see dialysis being done here, you know.
In the recent past, the hospital has made progress in handling kidney disease after increasing the number of machines for dialysis, artificial kidneys, from 2 to 22.
Adequately. If you concentrate on controlling hypertension and treating diabetes, so most of the times you are successful in decreasing the incidence of kidney diseases. Because these two comprise to around 60 to 75% of the kidney diseases.
Risk factors of the disease include risky lifestyles like tobacco use, unhealthy diets, lack of exercise and excessive use of alcohol. Florence Alimba, NTV in Mulago.